Well, good evening, everyone. Welcome to the acupressure series with Dr. Baritz. I believe this is class 3. I'm sitting in for Ben Viola tonight because Ben, guess where he is? He's at the Boston Red Sox game, huh? Probably sitting on the Green Monster, having a cold one, eating some peanuts. But anyway, we'll wish him well. It's a chilly night, but he'll have fun. So, without further ado, let's get right into the information here. Again, remember, if you have any specific questions, please put them in the Q&A box. If you're answering me or answering Dr. Baritz directly from questions we ask or vice versa, please put those in the chat box and we'll get right started. All right, here we go. Dr. Baritz, take it away.
Hey, well, so great to be with you here tonight. Let's take a look at our webinar. This is part 2 of the migraine prevention and treatment protocol. Last webinar, we covered migraine treatment, and this webinar is about migraine prevention, but I am including a little information about treatment, which you'll see in just a minute. So as we covered last time, a migraine is a headache that can cause a severe throbbing pain or a pulsing sensation, usually on one side of the head. It's often accompanied by nausea, vomiting, and extreme sensitivity to light and sound. Migraine attacks can last for hours to days, and the pain can be so severe that it interferes with daily activities. Migraines have a general protocol, sequence: the prodrome, the aura, the attack, and the postdrome. Not everybody who has a migraine headache goes through all the stages or realizes that they're going through all the stages. This is the most important slide of the last seminar and of this one. In the prodrome, that is really digestive disturbances, and it may precede the actual migraine headache by as much as 2 days. A person might be experiencing mood changes. They may feel depressed or go all the way up to feeling euphoric. They may have food cravings. They might have a stiff neck. They might notice increased urination, fluid retention, and frequent yawning. So that would be the prodrome. Some people are aware of it. Some people aren't aware, but it's happening. The next thing that happens is the stomach upset sends signals along the vagus nerve. The vagus nerve, as you know, is a cranial nerve that runs from the digestive tract up to the brain. When it hits these unpleasant signals hit the brain diffuses them so the person will not experience so much pain. That diffusion then causes that electrical impulse to hit the arteries in the veins, which cause the arterial walls to constrict. Vasoconstriction leads to decreased blood flow in multiple areas of the brain, and that decreased blood flow leads to what's commonly called the aura. The aura are a visual phenomena, such as seeing various shapes, bright spots, or flashes of light. There might be a vision loss or a feeling of tunnel vision. There might be a pins and needles sensation in the arm or their leg. There might be weakness on the face or on one side of the body. The person may experience difficulty speaking. In an extreme case, a person might feel like they're having a stroke and be seen at the emergency department where they'll have to be evaluated. Finally, so those arteries are holding on as tight as they can, but the arterial wall, the muscles of the arterial wall are not designed for prolonged contraction. So they fatigue and pop open. When they pop open, blood rushes into the brain, and that causes the actual migraine attack. Now there's going to be pain, usually on one side of the head, but sometimes on both sides of the head. It could be a throbbing or a pulsing pain. Typically, there's extreme sensitivity to light and sound, sometimes smell, and many times people will retreat to a dark room and pull the covers over their head. Nausea and vomiting may occur. The postdrome, the migraine headache itself, might last for anywhere from a couple hours to, it could be a day or two. After the headache, the person is exhausted, and now they're in the prodrome or the adrenal exhaustion phase. Person might feel drained, confused, washed out for maybe another day. Some patients report feeling elated, and sudden head movements might bring on head pain briefly. So this is the download that I've prepared for you for your patients, prevention of migraine headaches. And if you simply download this and give it to your patients, it will give them the video that you're about to watch in just a couple of minutes, plus an explanation of how to find the acupuncture points, or explanation of how to locate an acupuncture point, and then the exact pictures and location of the acupuncture points, as well as the standard process products and the dosage, and of course the medical disclaimer. I just want to go to the front here for a minute. So if you care to email me, if you want, I will take out the drbaritz.com over here, and I will put in your name, your website with a clickable link to you. When you give this to patients, email it to patients, it basically refers them back to their physician, who they're going to need for support. So that is the protocol. Now, food liquid, that encourages a healthy blood calcium phosphorus ratio, promotes a healthy cellular metabolism, supports bone health, contains phosphoric acid. The dose is, for prevention, is 10 drops of water upon arising. The next is bin checks, and that is 3 once a day. And that, of course, supports the nervous system, is a moderate calmative, and helps relieve the effects of temporary stress. The next product is Neuroplex, 2 once a day on an empty stomach, usually when they get up in the morning. And that, of course, supports the nervous system, cognitive functioning, contains a broad spectrum of vitamins and minerals. The next is AC Carbamide, and this promotes healthy blood flow in the brain and the passage of tissues through semipermeable membranes. And so, part of the problem is all that vascular changes up in the brain. And when you take that AC Carbamide, that mitigates or buffers those changes, so it reduces the likelihood or the severity of getting a migraine headache. Also, you want to consider Livco, which is a detoxifying product if you feel your patients may need detoxification. And Antranex is another great detoxification product from standard process that we use for any kind of allergies, any kind of detox, high blood pressure, anything where liver might be involved. Final adrenal complex, that's great for anyone who's stressed, except those who are taking high blood pressure medication. And then Cataplex G, which is fabulous for stress. It relaxes the nervous system. It relaxes the arterial wall, great for high blood pressure. And this is the video. I'm going to play it for you in just a minute.
Hello. In this video, I want to show you a natural, simple, and tested procedure for reducing the frequency and severity of migraine headaches. Migraine headaches can be a severe throbbing pain or a pulsing sensation, usually on one side of the head. Migraine headaches are often accompanied by nausea, vomiting, and extreme sensitivity to light and sound. Migraine headaches can last for hours or days, and the pain can be so severe that one needs to retreat to bed in a dark room. For some people, a warning symptom known as an aura occurs before the headache. An aura can include visual disturbances such as flashes of light or blind spots, or tingling in the face, arm, or leg. Some people have difficulty speaking. Whether migraine headaches are infrequent or if you have them every week, even one is too many. The best strategy is to prevent the migraine from ever occurring. A German randomized controlled study showed that participants had significantly less migraine headaches when they received preventative acupuncture. Another trial showed that 6 weeks of acupuncture was at least as effective as 6 months of daily medication. In another 20 high-quality trials involving over 4,000 participants suggested that acupuncture was at least as effective as drug treatment for the prevention of migraine headaches. If you've already had your first migraine headache, the time for a safe, natural, and easy-to-use preventative treatment is now. In the next few minutes, I will show you how to locate and activate 3 acupuncture points that have been used for centuries to reduce the frequency and severity of migraine headaches. I will also show you simple strategies to address the root causes of migraine headaches. My name is Dr. Baritz. I'm a chiropractor, nutritionist, herbalist, and I'm certified in acupoint physical medicine. I've helped thousands of people live healthier and happier lives, and I want to help you too. If you like this video, please give me a thumbs up, subscribe, and hit the bell icon to be notified when more videos come out. The first point for migraine headache prevention is called Yin Tang. Yin Tang is known as the Hall of Impressions. Yin Tang is one of the most powerful acupuncture points for stress and anxiety. In addition to helping prevent migraine headaches, Yin Tang is used to relieve stress, anxiety, eye strain, and sinus issues. Yin Tang has been used to reduce all types of pain and improve upper body strength. Yin Tang is located between the inner ends of the eyebrows, right over here. To activate Yin Tang, rub this point 5 times quickly, take a break for a count of 5, and repeat 4 more times. It might look like this. Or if you have a Tei Shin, it might look like this. After activating Yin Tang, you may feel heat or energy in your eyes, ears, face, or head. This is normal and therapeutic. The next point for migraine headache prevention is large intestine 20. Large intestine 20 is known as the welcome fragrance point. Large intestine 20 is said to regulate the sense of smell, open the sinuses, reduce facial nerve pain and tics, which makes it perfectly suited for migraine headache prevention. Large intestine 20 has also been used for trigeminal neuralgia, nosebleed, nose polyps, and mouth deviation. It is believed that large intestine 20 works by promoting healthy nerve function and healthy blood flow. To locate large intestine 20, locate the midpoint of your left ali nasi. The ali nasi is the flare at the end of your nose. That is, this area right over here, and the midpoint would be right here. Now move to the left until you come to the nasolabial groove. The nasolabial groove is the fold that runs from the side of your nose down to your mouth. Push in this spot until you find an area that is sensitive, sore, tender, or painful. That is the welcome fragrance point. Activate this point by rubbing it 5 times rapidly. Take a break for a count of 5 and repeat 4 more times. It might look like this. Or if you have a Tei Shin, it might look like this. Now find the welcome fragrance point on the right side and repeat. After activating the welcome fragrance point, breathe in through your nose and out through your mouth. Do this a few times. Notice your breathing seems easier and your sinuses seem clearer. I will cover the all-important third point for preventing migraine headaches in the next few moments. In addition to these acupuncture points, identifying and avoiding triggers such as certain foods and perfumes have been helpful for some. And digestive support has been advised for thousands of years to prevent migraine headaches. The third point recommended for migraine prevention is kidney 27. Kidney 27 is known as the palace of transportation because it is said to regulate the balance of the flow of fluids in the body. In addition to helping prevent migraine headaches, Kidney 27 is used to alleviate coughing, breathing difficulties, and chest pain. To locate Kidney 27, find the notch at the top of your sternum, right about here. Then move to the left the width of your thumb twice, just like this. Press in and find the spot that is sensitive, sore, tender, or painful. That is Kidney 27. Activate this point by rubbing it quickly 5 times, take a break for a count of 5, and repeat 4 more times. It might look like this. Or if you have a Tei Shin, it might look like this. Now find Kidney 27 on your right side and repeat. If you are interested in reducing the frequency and severity of migraine headaches, I suggest that you activate Yin Tang, the Hall of Impressions, Large Intestine 20, the Welcome Fragrance Point, and Kidney 27, the Palace of Transportation, twice a day for the next 60 days for initial results. Then activate these points twice a day for maintenance. It is my wish that the future will bring you more happy, migraine-free days.
Well, great. So I'm going to, I hope you found that entertaining and useful. And I hope you can see how this is going to, help your patients. It's really intended, for a busy practitioner. Of course, you can learn and do the points on the patients yourself, but you could simply give them the brochure, tell them to watch the video, and tell them to get the supplements. So I'm going to end the screen share and now field any questions that are available, that are there. So
It's good stuff there. We've got a shy bunch tonight. I think this is the head of the class tonight, so they already have their answers to their questions.
Oh, great. Well, I'm so glad to hear that.
Yeah. So actually, there was one that came in the chat box. So it was more of a comment, but I think Constance would like to see what your feedback is on this. I'll read it to you. Could you speak to controlling a rise in blood pressure? Because for me, my blood pressure gets elevated. She gets a terrible headache. This happened the last 2 weeks. I've had a significant rise in my blood pressure levels, and I'm not aware of why that would be happening. I increased my supplements. Looks like she's on Hawthorne, B-Core, Cyruta, Cardiotrophin, organically bound minerals. Do you have any ideas as to why? And I mean, Constance, you can type in a little bit more to give us some more clarity if you'd like.
Well, blood pressure is a significant issue, and we can actually do a webinar on that.
Great.
However, I'm just taking a quick look here for blood pressure. Yeah, I don't have my sheet right here. So let me say this. If you're feeling your blood pressure going up, I would activate Heart 7 right away, and I'll show you how to do that. And then Keith, unless there's an objection, I think blood pressure would be a great subject to go over on our next workshop.
Yeah, I think that's amazing. That's one that I get a lot, and my first answer to everybody is depends on where it's coming from, right? I mean,
That's true.
Like there's so many roads to blood pressure, kidney, heart, lymphatics. I mean, you name it. There's a lot of things. So that would be wonderful if you could cover that. I think it would give us some good insights.
But can anyone see? Can you see me?
Yeah, I can see you.
Can everyone else see me?
Let's see.
So Heart 7 is easy to locate, and it starts at the crease of your wrist over here. And if you have more than one crease, you want to get the one that's closest to your wrist. And you go to the pinky finger side. And then on the pinky finger, you start from the tip of your pinky finger going down the side until the 2 points intersect. And that'll be the point that's the border between sort of the dark tan skin and the lighter pale skin. So if you just push in there, you're going to find a tender spot. And then go ahead, activate that point by rubbing it quickly 5 times. Take a break for count of 5. Repeat 4 more times the same way. That's called the spirit gateway. And it does indicate that the Chinese believe it helps you become, reach a greater spiritual realm. And this means that typically it's going to reduce the stress in your body. You're going to feel calmer and more peaceful. So that's a great point for high blood pressure. And it's also a great point for anyone who has any trouble getting to sleep at night.
Perfect. So Margaret had a quick question on that. Are you stimulating on both sides or just the side of maybe where the headache is?
You want to stimulate on both sides. So body points are typically done on both sides. Ear points, which we may cover in another workshop, are typically only covered on one side. And there's a little procedure for finding out which side to do. But all body points are done on both sides. And if you say, for example, you have an injured ankle, you want to start on the good side, and that will sort of prime the injured ankle to heal when you get to the injured side.
Great. Very good. So Ginger is saying, yes, blood pressure, Dr. Baritz. Let's do whenever you can cue that one up next, that'll be wonderful.
Fabulous.
Constance is saying, yeah, boy, my right heart 7 really, really hurts.
So it's a hot spot on you. So it was a good call.
Yeah.
It was a good call, and it was a hot spot. You know, if you have a minute, I just want to share a story. You know, this acupuncture, you know, it's amazing. And it's not that difficult to do if you want to take a simple approach. So I had a sort of a panic phone call from a friend. Her husband was in intensive care at a major Boston hospital. Of course, I won't mention any names. So what had happened was he developed hiccups about a week prior, and they just wouldn't go away. And now he couldn't eat, and he was having trouble sleeping. They just wouldn't stop. He couldn't get any relief. So this carried on, and of course, the person becomes exhausted, and the person becomes fearful that this is going to be their life from then on. I mean, it's bad. So he ended up in the hospital, and so they're kind of, you know, examining him, blah, blah, blah. And then they check, and he's now developed a heart arrhythmia. So he's in the hospital. He still has intransigent hiccups. He has heart arrhythmia. What they want to do now, what they're proposing to do, and this is during COVID, and so the wife can't even be in there to support her husband. So this is during COVID, so they can't support it. So they want to start drug treatment to try to stop the headaches, stop the hiccups, and then they want to put him in for cardioversion. Neither of these things really pleased this person. So she called up and said, well, you know something? I've got a video online about hiccups. And it was just kind of a lark that we even made the video. So he's in the hospital. She's on the phone. I give her the video, coach her through it. Then she calls her husband in the hospital. I don't think he can even log into the video. And she coaches him through the points. Well, the story is the hiccups went away during this coaching session. Then a nurse came into the room, and the hiccups came back, but not quite as bad. The patient then reported the next morning that he got his first good night's sleep in weeks. Over the next few days, the hiccups began to recede. At the same time, magically, the arrhythmia went away. So then they said, well, you know something? We don't need you in intensive care anymore. We need this bed. They moved him to a regular hospital bed. And as the arrhythmia went away and the hiccups were past history, the patient was then released from care. So I got to tell you, I am so excited, you know, with these points. Something as silly as hiccups, you know, the Chinese, they worked this thing out, and something as serious as you know, strokes and heart attacks, we've got the dope on them too. And then if you match this with standard process products, you know, you're in really You're really doing something for your patients. Well, thank you for listening. If there are any other questions, I will answer them now. If not, I look forward to seeing you next week.
Yeah, that Dr. Baritz, it looks like that is it. We have a very content bunch tonight. Thank you all for joining. Yes, you all get the replay. If you didn't get the notes that was sent out this afternoon, either reach out to me or Kara. I know Kara is on maternity leave, so she's working like 7 to 10 hours a week still. But that's it. Great stuff tonight, Dr. Baritz. I think every single point you had tonight was sore on me, so I'm going to go work on those while I watch the Red Sox this evening. Anybody that has any questions for me, reach out to me during the week, and we'll see you all next Tuesday night.
All right. Good night.
Take care.